delivered to secondary school students, or what we call VETDSS for short. This information session is focusing on our Allied Health Assistance course run at Box Hill Institute. First of all, obviously, thank you for attending today. We'll run for about 20 minutes or so. We'll have at the end some links if you're looking for further information or have any questions that you might need answered after watching this session. So first of all, as I said, this course is Allied Health Assistance. So a bit of a background as to what actually is an Allied Health Assistant. What is the course? What's the job? What is the role, I guess, at the end of the course? So why Allied Health Assistants? So Allied Health Assistants work under the supervision of an allied health professional to help clients achieve their functional goals. And these AHPs, Allied Health Professionals abbreviated, they include your physiotherapists, occupational therapists, podiatrists, speech pathologists, dietitians, social workers. All those health professionals that aren't either a doctor, a nurse, or a dentist come under that umbrella of an allied health professional. And these are some of the main ones that I've listed here that allied health assistants tend to work with in the community or the acute setting, wherever it might be. Because the role can be performed in a variety of settings. So you can work as an allied health assistant in hospitals, in the community health services, private practices, aged care facilities, and also disability services as well. And healthcare is one of Australia's largest and fastest growing industries, so there is lots of demand for staff and particularly allied health assistants because there is a massive increase in demand for healthcare workers, and that assistance phase is increasing as well in that area of practice. So it is a very, very growth area if you're interested in job prospects. As to the course overview and structure, so this program will introduce you to the skills and knowledge required to provide assistance to allied health professionals involved in the provision of direct client care in the range of settings. So what we mean by direct client care, that's working directly with a patient, directly with a client. And as we said, whether that's in a hospital, aged care facility, community health centre, whatever it might be, it's within that direct client care approach, so working directly with someone in a range of settings. As part of the course, you'll develop a range of factual, technical and procedural knowledge and skills relating to a variety of areas. So relating to infection prevention and control, obviously very, very topical at the moment, workplace health and safety, client movement using a range of assistive equipment. So that could be helping a client use like a wheelchair, helping them with a walking frame, or using equipment to help the clients to mobilize out of a bed, like a hoist or a slide sheet, things like that. Also learn about workplace organization and also communication. So we study a variety of units and learn a variety of skills that are applicable across a range of areas. Obviously focus on healthcare, but you learn a lot of different things that will help you across a variety of areas of study or your workplace, wherever it might be. It's important to note that this VETDSS program, so VETDSS program, is what we call a partial completion of the Certificate 3 in Allied Health Assistance qualification. So we don't actually complete all the units to attain the qualification. So at the end of the course, at the end of the 2-year period, you'll attain you'll be eligible for a statement of attainment towards completion of the qualification. So you will complete a variety of units that you can then, if you are interested in wanting to complete the full qualification, those units can be counted towards that full qualification. So count as what we call the credit to those to that full completion of the area of study. But I'll go over what those units are in a few more slides and sort of how that looks and how that works. So the course structure and overview of our Certificate 3 in Allied Health Assistance. So it's a variety of online and on campus. So the campus that this course is undertaken at is our Algar campus, which is in Box Hill. So it's just down from Box Hill Central or Box Hill Station. And it's also delivered online. So we basically, essentially when we sort of work it, we do our theory or our information-based classes online, and then we come onto campus for our practical-based skills. And we found that's worked quite well over the last 18 months, and that's sort of the plan at this stage for next year. So the course does go for 2 years, so it runs across 2 years. The day we run this course is on the Wednesday, and we do have 2 time slots that we do run this course on. So we run it from 9 a.m. to 12:30, or from 1:30 until 5 p.m. When you enroll, or if you enroll, I should say, you are enrolled into one of the time slots, and that's the time slot that you attend for the year. You don't sort of chop and change. It'll be that one time for the entire year. And as I said before, the delivery model is what we call face-to-face theory classes, so either remote or online. So it's done as an online session. You log into our performance at the bottom via MS Teams, and we run the class virtually. And then we also come onto campus for our practical classes. There may also be what we call some self-directed study via Student Web. So Student Web is our online learning system. And sometimes there might be a class that is like a self-directed study session or working on assessment tasks. So a variety of different teaching methods that we have across this program. And as that little proviso at the bottom states, and that the reasoning why we still continue to do our theory online is because obviously while measures are in place to curb the spread of coronavirus or COVID-19, the theory components for this course will be delivered remotely via Microsoft Teams, and practical components delivered on campus with social distancing and infection prevention procedures in place. So units of competency. So we do a variety of units, as you can see here. Across the 2 years, we do 1, 2, 3, 4, 5, 6, 7, 8, 12 different units, so quite a variety. So the really great thing about this course is you do get to study and learn a variety of different skills across a variety of different areas of interest. So we sort of start off with workplace health and safety, infection prevention and control, so really topical things. We then do some work around personal work priorities and development, communication, assisting with movement, which is assisting a client with practical movement skills, providing a high standard of service, first aid. We do at the end of first year as well, which is really great. So you do get a qualification, you do get a first aid certificate, which is always highly looked upon if you're looking for part-time work or just in general. It's a really good thing to have. There for year 1, and then year 2, we do what we call medical terminology, so understanding different medical language. We start doing some what we call recognized healthy body systems. So that's around looking at how the body works and the different body systems that are contained and how all that interlinks for health outcomes. Transporting individuals and engaging with health professionals in the health system. So we do a variety of units, as I've said, and it's a really engaging course because we're doing something different every few weeks. We're not sort of doing the same thing for, 10 weeks. We might do, assist with movement for 5 weeks, so a really hands-on unit. Then we might come across to communication, so looking at how we build our communication skills. So it's a really diverse course, and you get to learn lots of different things and lots of different areas of study, which is always really exciting, and it always keeps it fresh and interesting. So how VETDSS Schools integrates with VCE and VCAL. So with VCE, your Certificate 3 in Allied Health Assistance can be used as a primary 4 study or 5th and 6th study. So what that means is that can count as your primary 4 for your VCE for your ATAR score, or it can obviously be used as a 5th or a 6th as well. If you're wanting to have the course count as part of your primary 4, 5th and 6th, you'll need to undertake what we call a scored assessment if you wish to have that contribute to your ATAR. I'll cover that next slide, but that's primary for second year, not for first year. It's just second year that's required for scored. If you're doing VCAL, for a VCAL contribution, 90 nominal hours of training is required for 1 VCAL unit. That's what counts towards it. And we also have within the course, we have what we call structured workplace learning, which across the 2 years of the course, so year 1 and year 2, a minimum of 80 hours of structured workplace learning is required. So it's essentially like work experience, but we'll cover that in a couple more slides. So as I said before, scored assessment is available for this VETDSS program. Students wishing to receive an ATAR contribution for VCE Vet Health must undertake scored assessment. So that's therefore you get a scored result, and that can then count towards your ATAR or give you an ATAR contribution. This consists of 3 coursework tasks worth 66% of the overall study score, and the end of year examination, which is worth 34%, or the remaining third of your overall study score. Scored assessment is based on only second year units, so not first year, so only for second year. And it's focused on, if I go back a couple of slides, medical terminology, body systems, and transport, the three that, and sorry, these two here are what the exam is based on, medical terminology and body systems. And then we do scored assessment, and then these two combined for the last scored assessment. So why choose Box Hill? Why come here and study? Why I like to do a vet course in general, first and foremost? Well, we've got some really great facilities at Box Hill to really replicate the real world. So we have proper equipment, equipment that is used in the hospital, in the aged care facilities, ward setups, walking equipment. All our equipment that we use is replicable of the real world. So it's a really positive hands-on experience that you will experience in the course. As I've said, all students will participate in on-campus practical classes, and they're delivered in what we call it within our purpose-built simulation rooms. So we've got allied health therapy rooms, we've got aged care simulation rooms, and we've also got hospital ward simulation rooms. So the benefit of using these simulation rooms is that when if you go and get a job or start working in the healthcare field, the equipment you're using, the environment you've trained in is very, very similar to the environment you're going into. So it takes away some of that stress and some of that unknown going into those new environments because you've done the skills as they're done in industry. So if you do come to the course, or if you do come, what is expected of you? So exactly the same sort of setup as your normal school environment. Same expectations, same requirements. So all students must attend their scheduled class each week. So you need to be attending, as I said, either at 9 till 12:30 or 1:30 till 5. You need to be attending those classes every week. Obviously, we've only got a limited time per week. 3.5 hours a week isn't a lot of time. So we do really need you to be, you do need to be attending those classes to get the required information and obviously complete those practical tasks as well. We really do strongly advise all students not to schedule any appointments on a Wednesday afternoon. Again, for that reason that I mentioned before, because of the lack of time. Obviously, we only have one session a week. We really need to have those days free for you to be attending TAFE and completing those area of studies. Whilst we're in attendance, the class, whether that's on campus, so in person or online, the same expectations apply. While in attendance, students are expected to behave in a mature manner, respecting each other, their teachers and classmates. So it is really important that you have that professional behaviour. We are at times, using machinery or using, hoists and slide sheets. So there is an element of risk there. So you do really need to be behaving in a mature approach, respecting yourselves, respecting the classroom, respecting your fellow peers. And obviously mobile phones during class time is not allowed. We're there to learn. We need to be, focusing on the studies, obviously, in those times. So for coursework, so the actual work that we do in the course, assessment tasks, etc. So within the course, you'll be expected to, also required to participate in theory and practical classes for each unit. So as I said, we do theory, so we obviously do a classroom base. We're learning the material, learning the information, and we also then have some practical ones where you'll be doing, hands-on practical skills. That could be infection control processes, so hand washing, hand hygiene, putting on, taking off personal protective equipment. Or that could be, our assist with movement pracs, communication pracs, whatever that might be. We have a variety of assessment tasks, a variety of classes that we do, and therefore a variety of assessment tasks. Because we do have a range of assessment tasks that we do need to complete for each unit. So we do have quite a few assessment tasks per unit. So there is a bit of work to do throughout the course. It can be demanding at times, and being organised and being on top of those things and attending will help to minimise that that sort of level of stress that can happen by attending each class and participating fully in each class. So just this is a mindset or a thought process around how much time it might take per week. It says be prepared to commit additional time each week to your studies. So approximately about 3 hours. Some weeks might be less, some weeks might be more. It just depends on how many assessment tasks and the units are on the go. But approximately 3 hours per week across the course is what we've found allows students to keep up to date, know the content, feel confident with doing their tasks, and be able to work through it in a really positive way. We have a variety of assessment tasks that we do. So assessment tasks will include written assignments, role plays, simulated practical classroom activities, and structured workplace learning. So again, similar to the classroom environment, our assessment tasks are also very diverse as well. They're not all just, question and answer or written tasks. We do a variety of tasks. So there are quite, while it's still an assessment task, they can be quite enjoyable to do. Now, slightly different to high school in the way, I guess, the TAFE sector works, is that each assessment task obviously must be submitted by the due date, but then will be assessed as either what we call satisfactory or not yet satisfactory by your teacher. So what that means is you don't get like a grade, like you don't get a 90% or a 70% or a 60%. You'll get graded either what we call satisfactory or not satisfactory. So what happens there is, you need to basically get all the questions correct in that sense. To achieve that satisfactory grade. If you get something wrong, we do have a few attempts at the assessment task to get that satisfactory grade. So slightly different to the way high school might work. So that's per assessment task. Then the unit, so the unit itself, the overall area of study for the unit you're given an overall mark of what we call competent or not yet competent. So you need to complete all the assessment tasks and achieve a satisfactory grade for those to achieve that overall grade of what we call competent for the unit. And what that means is that grade of competent, we're saying as a teacher that you're competent, you've displayed the knowledge and you're competent to assist someone with movement. You're competent in infection control and prevention, whatever the area of study might be. If you cannot submit your assessment on time, you may discuss an extension with your teacher or apply for special consideration. We understand, things happen throughout the year. Stressful events, etc., those sort of things. As with your normal school, discussing those things nice and early is going to help with your level of stress, and obviously then help with managing those expectations as well. So as part of the course, as part of this course, we VCAR, the head authority, VCAR. VCAR mandates a minimum of 80 hours of structured workplace learning is required over the duration of this course. So that's like a placement or what often is called work experience. So structured workplace learning may be undertaken in a range of settings, including community health centres, aged care facilities, private practices, hospitals, any sort of healthcare environment. Your structured workplace learning may take place. Now, it is the responsibility of yourself and your school to ensure that this requirement's met. As teaching staff, we can suggest some places to try and apply, give you some links, etc., of places that might take students, but ultimately it's your and the school's responsibility, the school, to assist you in locating a place to complete your structured workplace learning and making sure that that is completed across the 2 years or each year period. We will provide all the required structured workplace learning documentation, the orientation session, and throughout the year when you book in and when you're ready to go. And we will provide you with a Box Hill polo top to wear on those sessions. And when you go to your placement, you normally wear this polo top, dark coloured pants, closed-toed shoes. That will depend on the environment you're going into. Some workplaces will have a slightly different dress code compared to others, but that's a fairly general dress code that is appropriate for the healthcare environment. Industry and pathway options. So, as I said, this is a really great introduction to the healthcare field, really great introduction to work, to a career in health. If you're interested in whatever area of health it might be, it's a really great area to start in because you get that sort of taster of a variety of different areas, and allied health can go into a myriad of different spaces. So you can obviously complete further studies. So you may choose to fully complete the Certificate 3 in Allied Health Assistance, or you may like to enrol in the Certificate 4 in Allied Health Assistance as well. You might want to complete individual support or working in disability sector, and the units that you cover and complete in this course may count towards credit for those courses as well. You may also, what is quite popular often, we have quite a few students, generally speaking, each year, do the program. So do our VETDSS program in Allied Health Assistance, then they will enrol in a diploma of nursing. So it's a very a seamless pathway into that nursing program as well. And what this communication skills, the infection control skills you build and develop, will hold you in good stead across all those different areas. You might also be interested in studying at university, so doing a bachelor's course in physiotherapy or occupational therapy, dietetics, nutrition, social work, whatever it might be. And again, these allied health assistant skills are transferable across. So it's a really great, as I say, really great taster to the healthcare industry is this course. Employment opportunities after the course. So you may be able to be employed as an allied health assistant, patient care assistant, patient services assistant, or a ward assistant. So you may be able to gain employment in those areas. Generally speaking, those students will likely need to complete the full qualification to gain employment. So, you may be able to be employed in these areas once you finish the end of the course at the end of the second year period. But most workplaces want the full completion, so you might need to come back and do a few more extra units to finish off that course and get that full qualification. So thank you for listening today. Thank you for paying attention and listening. If you have any further questions, anything that maybe I didn't quite answer in this session today, or anything that you want to get clarified or not quite sure on, you've got a variety of areas to access information just on the left-hand side here. So this email address here, vets@boxhill.edu.au, is probably the best place to contact, because they can then forward your inquiry to the respective area if they can't answer it 100%. Or obviously answer your question directly as well. But you can get further info from the Box Hill website, either via phone, Facebook, or Instagram. We've got a variety of information on there, but the email is the best part if you've got any specific questions. Thank you all for attending today. Hopefully I get to see quite a few of you on campus next year, beginning your journey into healthcare. My name is Lachlan Bryant, for those that may have joined halfway through. I'm a dietitian by trade, and I teach in the course as well. So thanks for paying attention today. Look forward to seeing some of you, or all of you hopefully, next year in 2022. Take care, and I'll see some of you then.